Good evening, everyone, and welcome to this webinar on safe listening on World Hearing Day. Our session is in line with the World Hearing Day theme of To Hear for Life, Listen with Care. My name is Ruth Warwick, and I will be the moderator for the session. The session is being sponsored by Wavefront Centre for Communication Accessibility and the Canadian Hard of Hearing Association's British Columbia chapter and Vancouver branch. Please note the session is being recorded so others can enjoy it afterwards. We have sign language interpreting and we have captioning. If you prefer to view your captions in a stream text link, please go to the chat box for the link. Our captionist is Ella Arnston, and our ASL interpreters are Susie Garox, Joy Emerson, and Kayeen Kirk, and they will be rotating in 20-minute intervals. Just a few housekeeping, and we will go to the next slide for the first housekeeping item. Okay, we need to go back to the slide. Okay, great. So asking a question to the panelists. We are going to have a question period after our 4 amazing speakers complete their talks. It will be through either you're raising your hand using that function at the bottom of your screen, or you can put your question in the Q&A box and we'll be monitoring that. You can do it at any time throughout the session. Next slide, please. We have this slide up just so that you can see about how you can adjust your screen in order to make it larger or smaller just by using a drag function. And under view options, you have different ways in order to view what you will see on your screen according to your preference. Okay, so again, that completes our housekeeping for now. But throughout the session, we will have a few polls, and we're going to start with our first poll now. Could we have the poll shown up, please? We're going to give you 20 seconds to answer this question. How would you rate your awareness of safe listening practices? You have 20 seconds to give your answer. Five seconds left. Okay, the poll is now ended. So our participants, the 67 of you here today, which is an amazing number, 21% of you rate your awareness as being very high. Another 28% say high level. Average with 34%, and then only 17% low or very low level. So we're probably talking to an audience who is very aware of the importance of safe listening practices. But as we all know, there's much that can still be learned about this topic. And it is still a relatively new topic. I know when I was growing up, no one talked about safe listening. Now it's emphasized, and importantly so, because our hearing is precious. And those of us who have a hearing loss want to preserve whatever hearing we have. Those who don't have a hearing loss, well, you don't want to join the group of the hard of hearing people if you can avoid it. Okay, so we will now stop sharing the results of the poll, and I will have the pleasure of introducing our first speaker. So our first speaker is Dr. Amaryllis Melendez, who is a medical doctor and an ear, nose, and throat specialist and head of her department at the hospital in Centennial, Thomas, Panama. So she joins us from another part of the world. And she is the co-coordinator of the Safe Listening Working Group of the World Hearing Forum and will give us more information about what that involves. She's a member of the executive committee of her association and a Hugh Humphrey Fellow 2004 on the topic of hearing loss as a public health problem. We're delighted to have you join us, Dr. Melendez, and over to you.
Hello, everyone. Thank you so much for having me here. It's such an honor to be with you. I'm coming from Central America, and I'm part, as Ruth said, of the World Hearing Forum. This is a huge group of the six, and my group is the Safe Listening Group, which I'm with Dr. Lori. It is for this year, the topic for the World Hearing Care, and this is what we all do. The next slide, please. The next slide, please. So already know that we have this Android and the iOS where you can check your hearing and tell everybody around you to check the hearing. It's a very, very useful thing. The very good thing that is coming us here is that in 2017, the World Health Assembly in Geneva, the next one please, presented the resolution for the prevention of hearing loss and deafness. And this resolution has given us a big report last year, the World Report on Hearing, which promotes action. And during this report, although we got all the information we can get and evidence of what is happening with hearing loss around the world, it also gave us some resources that we can use. And one of those is how to get to noise reduction as one means of lowering the problem of hearing loss. The next one. In this part, to know what the problem is around the world, we have that 1 in 5 people around the world is affected with hearing loss, and we go to a staggering point of having 1.5 billion people affected by hearing loss all over the world. And this proportion is given in all the continents. And in our area, in the Americas, we have today 217 million people. But the staggering problem also is that if we don't do it, the things we have to do, we will be having almost double for that in 2050. The next one. So, the next one, yes. So we are healing and trying to work on with noise. And we have noise everywhere. We have the noise that we know, the environmental noise that is around us, and it's the second biggest environmental problem in the world. And it can give us also other problems, not only in hearing, but in the system, like high blood pressure or cardiac problems. We also have the occupational noise, which has been tackled by the governments and has more laws about it. But although we have laws everywhere, it's mostly about 7 to 21% across all the different ages. And this is because of exposure to noise in the workplace. But what is bringing us today now is recreational noise. And what is recreational noise? Is this noise that we ourselves get into in contact. And this is a staggering problem also that is getting at least an estimate of 1 billion young people at risk. And this group is about the 12 to 35 years old. And they get exposed because they use of personal audio devices, and also getting to go to entertainment places where the noise is very loud. The next one, please. For this problem, then we know that it is the second most important contaminant and the most important for prevention, because it can be prevented if we do all these of the safe listening measures. The next one. What we can do now is that exposure to recreational noise in terms of unsafe use of the personal audio devices, and that would be in the smartphones and the MP3. And this is dependent on time, the time we use it, the volume it's in, and the frequency of the use. And also in these exposures at the entertainment venues, sports events that can get to almost 112 decibels each. And this will get to this group of people that has been already estimated by the Make Listening Safe from the WHO. The next one. In sports, we also have a problem because we have that the noise generated by all these activities may get to also 117 dBs. And this was already seen by the World Cup of Football in 2010, where the noise in the stadiums went to more than 100.5 decibels. For this, there are some measures. The next one. The next, where are the preventive strategies across the life course? We have strategies that are public health measures like vaccination, immunization, maternal and neonatal care, and genetic counseling, which are more general. But for this special noise and problem, we do have the safe listening practices that will avoid or at least mitigate the problem of the hearing loss. The next one. The WHO and the ITU, the International Telecommunication Union, went together working for some time to give us information that was evidence-based and how we could do this. And then we have the norm, the H817, which was landed in 2018. And this is a kind of phones and MP3s. And what it would do is to give us an idea of how we are having contact with this energy, that sound energy. And we know that there is a measure, a dose that we can handle without having problems with our hearing. And that dose is given in pascals, which is a kind of energy term. This will take care of the intensity, the time of exposure, and the frequency of exposure. The dosimetry will be working inside the phone as soon as you put the earphones in, and it will give us an idea of how long you've been using your equipment and how loud. And it will give us, in terms of percentage, how much of your allowance for a week you have been using. So it would be using like something very really easy, like having the colors, the red, the yellow, and the green, and will give us also a percentage in terms of numericals. This way, you will be knowing if you're getting to the limit of the allowance you have for sound without having problems with your hearing. And there is another norm, the 871, for the amplifications that we have been using for the phones and the devices. The next one. The next one. To show you how the dosimetry works about, this is for an adult. We have two modes of working. One mode is for the adults, and the limits that have been evidence-based are to have 80 dB in the A scale for 40 hours per week. If we keep our hearing with these devices at this level, we can ensurely and use all these equipment without any problem. And we will be safe in terms of our hearing. There is another mode, the mode 2, which is for children because they are more sensitive, or people who have sicknesses. And this one starts with 70 dBs for 40 hours, for 40 days, 40 hours a week. Sorry for that. So here to the right, you have the scale where you have when you're using as 80 dBs, you can really use your phone at this point for 40 hours. But as soon as you keep using more volume, you will be lowering the time you have. And this will be given to you not in terms of this scale, but in terms of percentage. So it's easier to be used. This is a very useful tool for use for the group that we're heading to, which is the 12 to 35 years old, who are always using the phones. The next one. The other things are also to avoid the places where we have loud noise. And this was some difficulties that we're getting. And now we have that for this work hearing day, it was launched yesterday, the global standards also by WHO for the global standards for safe listening in entertainment venues. And this will give us the limits that are safe for us to enjoy music, to go to these places without harming our hearing. And it will take care of the sound level limits that would be the last would be 100 dBs for 15 minutes, measured in 15 minutes. Measurement of the sound throughout all the event to give provision of hearing protection. And this will be in terms of the earplugs, and that can be the foam earplugs or custom-made earphones. The dissemination of information and warning messages in these places have quiet areas where people can stay out of the loudness to recover from the time they have spent there. And the sound distribution and the management are given very specific details. So the persons who are in charge will take this into consideration to help us save our ears. This has to be promoted to the managers of the places, but also to the public. And this is why we're here today. As part of the Work Hearing Forum and the Make Listening Safe group, I really appreciate the opportunity of having been here with you to give us this information so you can look at all these new standards and use them throughout your life. The next one. So to care for life, take good care of yourself and listen safely. Thank you so much.
Thank you so much, Dr. Melendez. Just before we let you go, there was a question in the chat box, which is relevant to your presentation. So I'd just like to ask that now. It's if we could stay on this slide, there was a question about what DBASPL means and what weekly PA2H means.
Sorry about that. The DBA is the logarithmic of the bell, which is a measure of the sound. And the A is the scale that is used that is most relevant to how we hear. There are several scales, the A, the B, and the C. But the A is the one that is more related to how we hear. And the SPL is the sound pressure limit. So it's the way that we express the energy of the sound. And the second part, I didn't get it.
There was just a question about weekly and then the words PAH.
The weekly and the numbers there. Yes, this is the pascals, the weight of this energy. And this is, there is a formula that will take into consideration the pressure and the time. They would take the time limit in the through the period that you're hearing the music or the sound. And then for the adult, this formula will translate or will be traduced to this energy, which would be 1.6 pascals for adults and 0.51 for children. I didn't put the scale for children. I'm sorry about that, but these were all adults, so I did put it there.
Okay, great. Thank you for that explanation. And we can stop sharing the screen. Great. We will come back to you with more questions, but right now we're going to our second poll. And our second poll, if we could show that, is what safe listening strategies would be most effective for you? And we ask you to answer as many as you think would be effective. Give you 20 seconds to do that. We have 5 more seconds left. Okay, at this point, we're going to end the poll and we're going to see what the results are. So turn volumes down across devices, 88%, that's the highest. Number 2 is move away from the source of sound, 77% responses. And then use ear protection, such as earplugs and headphones, 72%. So those 3 are the top. But also limit time spent in noisy places. And then limit daily use of personal audio devices. Monitor safe listening levels. And then last, get regular hearing checkups. So almost all of these are considered possible strategies, with some getting a little higher ratings than others. Thank you so much for your responses. We won't stop sharing this particular poll, and we will then go on to our second speaker today. And our second speaker is Connor Stewart, and he has a hearing loss, wears cochlear implants in both ears. And I've had the pleasure of working with him the last 2 months, as he has been a community organizer for this event for the Wavefront Centre for Communication Accessibility, where I am also employed. He has his Bachelor of Science in Natural Resources with distinction from Oregon State University. It's my pleasure to welcome and give the floor to Connor.
Thank you for that introduction, Ruth. Welcome, everyone. A pleasure to be here. So, about me. As Ruth said, I was born deaf. I was diagnosed at about 6 months old, and I received the first cochlear implant on my right side when I was 18 months old. The second one on my left was obtained when I was 15, and I was born into a hearing family, including my parents. I did learn to advocate for my hearing loss from a young age, and used a FM system in the classroom during my mainstream education. And as the picture you can see on the bottom is the most current model of the Nucleus 7 cochlear implant with the external processor, which is worn on the head and on the outside of the head, and the internal processor embedded inside. So my experiences with sound, I find it hard to hear in loud environments, communicating in large groups, following the conversation. And, I have struggled with tinnitus for a couple of years now. And what that means is a constant ringing sound, while faint the majority of the time. I get some elevations of variation, ringing, hissing, or buzzing sound. And when this is the case, the best strategy is to, move to a quieter space or take off my processor. And I'm sure fellow CI, and I'm going to be abbreviating cochlear implants as CI for the duration of my presentation, can relate to when they receive new maps. You always have to adapt to the new sound and noise that comes with that. You know, sometimes that can be worse, sometimes it can be better. I'd like to share with you some of my tips for safe listening. You know, growing up in a semi-urban setting, of course, there's lots of traffic. So I tend to, you know, choose quieter walking routes. And when it's safe to do so, or when, you know, noise exceeds a comfortable level for me, I, you know, can just take off my processors, at which point I am completely deaf. And you know, I keep tabs on restaurants in my community that are, you know, quite noisy. I avoid those. And, you know, on public transit, you know, trains, buses, there's a lot of whooshing and hissing sounds that can be quite irritating. And I, you know, just don't wear my CIs then. And, you know, health and well-being strategies. So, you know, this can mean advocating for your rights and needs if you're in a situation where the noise is too loud, right? And practicing overall wellness. Now, Wavefront Centre had a survey that was made publicly available during the months of January and February. And there were 165 results in total from that presentation. And it was for the general public, but many of our respondents were hard of hearing. And the goal of the survey was to collect intel on the awareness of safe listening and the feelings about hearing protection in relation to noise. Now, most respondents felt that there is little awareness on the preservation of noise in society. And there was, you know, a strong affirmation for promoting safe listening because many of the respondents had a severe or moderate hearing loss. So they were very concerned with preserving what residual hearing they had. And I'm going to compare and contrast my safe listening tips to the strategies that were suggested by our attendees in the survey. And, you know, many of these people would, you know, wore hearing aids. So they could either take them off or turn the volume down. Wear ear protection, you know, whether this is earplugs or earmuffs. Now, I can't personally wear ear protection. You know, I find the best step is just to take off the CI altogether and move on now. So you can moderate your noise by using a series of apps. I've chosen these two, Decibel X, which is, you know, available on both Apple and Android platforms. And there's also the NIOSH sound level meter app. That's only for Apple, and that was developed by National Institute for Occupational Health and Safety in the States. And there's also a noise calculator that was developed by National Acoustic Laboratories in Australia, where you can actually input your activities. So your leisure activities, you know, if you go to concerts often, you know, do you go to restaurants or, you know, frequent areas where there's loud noise, and, you know, what kind of work are you involved in? And then the results will derive, you know, your risk from, you know, your inputs. That concludes my presentation. Thank you.
Thank you so much, Connor. And
You're
before
welcome.
you go, there was a question that popped up. Somebody wanted to know what are maps, and I think they're referring to mapping of CIs.
Yes, so this is when you go to the audiologist and they will tweak your cochlear implants. You know, usually these are annual visits, and, you know, it's based on what kind of, you know, your exposure to sound over time, you know, as you age and whatever environment you're in, they need to make adjustments accordingly so that you can keep up your response to sound and still hear productively.
Thank you so much, Connor. And you
You're
can
welcome.
stop sharing your screen, please.
Okay.
Great. So guess what? We have another poll coming up, and I need to just find my little script somewhere for it, but let's just put up the poll and we will see what it has to say. So our third poll is, what everyday sounds are you most concerned about? Those with construction, emergency vehicle sirens, etc. And we'll give you 20 seconds for this poll. We have 5 seconds left for the poll. Okay, the poll is now going to end, and we're going to see what the results are. So in this case, entertainment noise in discotheques, bars, and restaurants, that comes up highest at 66%, probably no surprise, because we do know that there are high noise levels there. Next is emergency vehicle sirens. In the building I work in, sometimes when there's a siren on, I think it's like right next door, as opposed to a block away. Can be really loud. And then traffic sounds. And our traffic sounds are probably mild compared to traffic sounds in some parts of the world. If you've ever been into other parts of the world where honking is one of the measures for safety, or letting the other one know that you're on the road too, the noise is really quite loud. And then construction sites, less so for hair dryers. Maybe many people don't even use a hair dryer anymore. Vacuum cleaner and a jet plane. Probably not too many of us have been traveling on a plane lately. Anyhow, very interesting results. So we will stop sharing that little poll and take it down. There. Great. So now I have the pleasure of introducing our third speaker, who is Hugh McCormick, Director of Clinical Operations and Social Enterprise of Wavefront Centre for Communication Accessibility. He has a master's degree in audiology from Queen Margaret University in Edinburgh, and he's worked as a clinical audiologist with the National Health Service in Edinburgh and with the Cochlear Implant Centre in Belfast, and as the clinical territory manager for Cochlear for Western Canada. All of this before he joined Wavefront Centre. It's my pleasure to welcome Mr. McCormick and turn the floor over to him.
Thank you very much, Dr. Warwick. So good evening, everyone. As Ruth introduced me, my name is Hugh McCormick, and I'm the clinical director here at Wavefront Centre in Vancouver. So I'm an audiologist, but prior to joining Wavefront, I spent several years working as a cochlear implant specialist, both on the clinical and surgical side with one of the cochlear implant manufacturers. Additionally, I'm also a musician and a former sound engineer, and I've spent many years abusing my ears and not using enough ear protection. So it's only in later life that I ever started using ear protection, and I really wish I'd started using it just a few years earlier. Today, I want to take some time to discuss hearing health and some safe listening practices, and I'm also kind of happy to discuss or answer any questions that you might have throughout the presentation. So often when we discuss hearing health, the data we use is European or US. So it's really lovely today to be discussing some Canadian specific information. Hearing loss and tinnitus are common amongst Canadian adults, with men being slightly more likely to suffer from either hearing loss or tinnitus. Overall, about 38% of adults aged between 20 to 79 years had hearing loss, while 37% had tinnitus. Now, when I say tinnitus, I'm sure a lot of you are familiar with it, but tinnitus is that sensation of hearing kind of ringing, buzzing, hissing, chirping, or other kind of sounds that don't come from an external source. So they're coming from, within the body. This noise can be intermittent, it can be continuous, and it can vary in loudness. It's often worse when background noise is low, and we often think that background noise acts as a masker to kind of drown out your tinnitus a little bit. For me personally, my tinnitus is loudest at night when I'm kind of going to bed and I'm trying to relax and I'm in a quiet room. And usually during my day-to-day, it doesn't affect me too much, unless I get a little bit stressed out and then I notice it significantly more. In Canada, hearing loss is more common at older ages, and much can be said for that across the world. While a percentage of Canadians with tinnitus, it's not age specific. Tinnitus affects people, from age 18 and above quite equally. And the funny thing is, a lot of people with tinnitus have no hearing loss at all. So a lot of it is kind of unexplained. So one other alarming kind of point of notice is that many Canadians aged kind of 40 to 79 years are unaware that they even have hearing loss. I've tested many clients and patients that's come in saying, oh, I don't have hearing loss. And once we put them in the boot and have their hearing tested, it becomes very clear that there's there could be a mild to a moderate, sometimes even a severe hearing loss that they weren't aware of. So how loud is too loud? So I've got two pictures up in front of me, and both of these devices are fairly similar. They're a little bit old school, but they work quite effectively. And what they both measure is the sound pressure level. And this is usually measured in dBA or dBc. Now dB just stands for decibel. And a decibel is the smallest sound that like a human can differentiate between. It's the smallest possible change in volume is counted as a decibel. The A part of it, the dBA, is just the weighting, and you'll see both of these measures available on devices like a sound level meter or dosimeter. But dBA is that kind of average weighting that's kind of a more kind of applicable to kind of human use. It's got a little bit more kind of emphasis on those high frequencies. When we're looking at how loud is too loud, there's three factors we really need to account for. We really need to think about the frequency, the level of sound, and then the duration of exposure to sound. I've got two graphs here which kind of explains kind of the level. So if we're looking at 0 dB, that's no sound, extremely, extremely quiet. Where 140 is on the other end of the screen is going to cause you almost physical pain. It's extremely, extremely loud. Now, the human ear can hear between 20 to 20,000 hertz. If anyone's ever been to an audiologist, they only ever measure a subsection of those frequencies during a hearing test. But we're also looking at the dB, the decibels of how loud a sound can be. So in normal conversation, it's usually around that 50 to 65 dB is normal conversation. A quiet office is 40, 45 dB. And, it gets quieter to almost no sound. As volume increases, a busy restaurant can often be around that kind of 80, 85 dB. Power tools can go up to almost 100 dB. A very loud chainsaw, 120 dB. And an aircraft taking off at close proximity is about 140 dB. So when we're thinking about kind of sound exposure, it's not just the volume we have to worry about. It's the frequency and the duration of that time that we're exposed to loud sounds. So kind of some numbers I've pulled from the CHHA, so Occupational Safety and Health Administration. If you're listening to sound around that 85 or 90 dB point, so let's think of it as a busy restaurant, you can have about 8 hours of exposure without too much concern. If we go to something a little bit louder, like a chainsaw or a power tool or something like that, you may only be able to get 2 hours in circumstances. If you're close to a jumbo jet, it might only be a matter of seconds or minutes before that can cause significant damage to your hearing. So most hearing specialists and researchers will agree you can damage your hearing if you're continually exposed to noise greater than about kind of 85 decibels. So the body is quite good at giving you warning signs when you've had a little bit too much exposure to loud sound. If you are getting pain or sometimes sensitivity after exposure to loud sounds, that's kind of a warning, you need to protect your hearing. If you're getting, and for me, where it's my tinnitus started was after a loud kind of music gig, I used to get ringing for maybe a few hours afterwards, which would sometimes last into the following day. So think of that as an alarm bell. If you start to get some ringing in your ears, it's time to stop, listen to your body and stop what you're doing. Sometimes, you can even have difficulty hearing for short periods of time after noise exposure. And that's something that audiologists refer to as a temporary threshold shift. And again, it's your body's way of saying, stop trying to punish me, and take a little bit easier on your ears. If people are frequently kind of asking you to repeat themselves, if you're struggling to hear noisy environments, these are all good times when you might need to go and have a quick chat with an audiologist to book an appointment. So how to protect your hearing? It's never too early to see an audiologist. Even if you think your hearing is perfect, it's really, really good to get a baseline hearing test. The beauty with hearing tests are quite often they're very cheap. Sometimes insurance covers for them. And for a lot of clinics, they just offer them for free. So it's never too early to go in, get a hearing test, and that allows audiologists to have a baseline so we can compare if your hearing ever does change further down the road. The second thing is to wear protective hearing gear. Now, sometimes it's not enough just to wear anything, it's having the right tool for the job. If you're someone working with power tools, industrial hearing protection is usually warranted. While if you're just in, listening to music, sometimes even foam hearing buds, you can pick them up in the pharmacy, will be sufficient to kind of protect you from those high frequency sounds. So quite often having the right tools for the job is what's important. If you're using iPods, it's really, really good to monitor the volume of your devices. In Europe, every iPod now has a limiter built into it. And that'll only allow volume to go to a certain level. I know you can push it a little bit kind of harder here in Canada and in North America. But it's really good just to keep an eye on the volume of the earbuds you're using, making sure they're not going too high. A lot of apps now will give you a rough estimate of how long you've been using your iPod for music and roughly the volume. It's semi-accurate at best, I would say. Another option, which is also really, really useful when you're listening to AirPods, is to have like custom molds made for your devices. The reason for that is these custom molds will block out a little bit of sound coming from the outside world, and it results in you not turning up the volume of your iPod or your AirPods to kind of try and mask or overcome surrounding sounds, environmental sounds. There's also, you can go a little bit fancier and get noise cancelling headphones, which will also do a little bit more to protect. So again, just to reiterate, it's never too early, even if you think your hearing is perfect, to get that baseline test with your audiologist. Audiologists are really good at giving you a copy of your hearing test, so it's always there for you to make reference to in the future. Now, for people with hearing aids or CI, cochlear implants, a question I get asked an awful lot is, if someone's wearing hearing aids, a cochlear implant, and they hear a loud sound, can that damage your hearing? And the answer simply is probably, it's no if your hearing aids are set correctly. So we have something called, in hearing aids and cochlear implants, is dynamic range compression. And what this kind of it's an algorithm does is it tries to kind of squash sounds just a little bit. It really tries to take that very quiet sound and increase the volume, and take those very loud sounds and decrease the volume. It really tries to compress or squeeze those sounds into a narrower band. The other beauty with this is it has a very strict limiter. It's usually, but not always, set around that 85 dB mark, depending on hearing loss, that can change. And it means sounds that are greater than 85. So let's say an explosion, you know, a chainsaw, that sound gets reduced down to a safer level. It usually brings it down to a safe level, but quite often it can still be a little bit irritating for people using hearing aids or cochlear implants. So it's a lot of people, you'll see if they're using power tools or in a noisy environments, they might remove their cochlear implant or turn down their hearing aids, or sometimes even take the battery out. And that's usually more for irritation than for kind of dangerous levels of noise. So that's my presentation, but I'll be more than happy to answer any questions that people may have.
And there are a ton of questions coming for you, Hugh, but we're going to hold them to the very end.
Certainly.
So bear with us. Thank you so much. And now we go to our last poll after screen sharing. This poll is going to appear on the screen now, and it asks us, how would you rate your awareness level of safe listening practices? And it's kind of a comparison to the first question. 20 seconds has started, and you have 15 seconds left to answer this poll. 5 seconds left. Okay, we're going to end the poll now. And what we are seeing is that the level has increased a little bit from what it was before, but definitely we have 74% rating awareness of safe practices as being high or very high. So we have a really, I would say, a very educated group here. And that's not surprising, because the fact that you're even taking part in this session means that you're interested in learning more about safe listening. So you already have an awareness to even be taking part in this event. So we're going to stop sharing this poll and move to our last presenter today. Last but not least, can we take down the poll? I think I'm to take it down. There we go. Our last presenter is Dr. Masato Kawamori, and he comes to us from Japan. This is the beauty of virtual webinars. You can have speakers from all over the world. And he is the project professor at Keio University and the rapporteur of Multimedia Framework for Digital Health Applications at the International Telecommunications Union, the United Nations Special Agency for Information and Communication Technology. And he's the editor of the WHO ITU Global Standard for Safe Listening Devices and Systems. We're very thrilled to have you join us. Dr. Kawamori, over to you.
Thank you very much, Dr. Ruth Warwick, for your kind introduction. My name is Masahito Kawamori. I'm very, very happy and honored to be here and to give this talk. Okay, so I hope I can, okay. So I will be talking about the standard from ITU and WHO. ITU and WHO started our collaboration in 2015 because of the concern about the loss of hearing, especially among the young population globally. So we started working with WHO, and we published a standard, or what ITUT calls recommendation, called Guidelines for Safe Listening Devices and Systems. And this first publication came in late 2018, and it was taken to WHO to be published in a different format, but the same content. And it's called Safe Listening Devices and Systems, WHO ITU standard. And this is the first global standard that will be used, I mean, hopefully used by many manufacturers to actually implement the safe listening guideline. The scope of this standard H.870 is what we call personal audio system, including headsets and so on, and iPad, iPod. And new devices are also being considered as new devices come into market, such as Bluetooth and so on. I will be talking about it a little bit later. But the current primary focus is on dosimetry that we just heard about, and how to calculate the listening level over listening time. And we define the recommended levels of safety doses, or what we call sound allowance, to be implemented. And also an important part of this recommendation is healthcare communication, to provide information to the user how to protect hearing. And this is a very general type of what we call personal audio system. It has a personal audio device with sound source, and then you have listening device such as earphones or headsets. And our recommendation level is based on the concept of equal energy principle. So I will be talking about this important principle. Equal energy principle is an assumption that the total effect of sound is proportional to the total amount of sound energy received by the ear, irrespective of the distribution of that energy in time. In other words, equal amounts of sound energy will cause equal amounts of sound-induced hearing loss, regardless of the distribution of the energy across time. So if you listen to low-level sound pressure for a long period of time, or if you listen to a very loud noise for a short period of time, the average will be the same. Average effect will be the same. This is the concept of equal energy principle. So loudness or sound energy should be calculated not only in terms of its loudness or the pressure level, but how long the exposure is made. So we, WHO and ITU, have come up with recommended level of sound exposure. It should be evidence-based, so there must be evidence regarding the relationship between safety and sound exposure that we recommend. And actually, there's substantial evidence and data collected for occupational noise exposure. And US regulation, as well as the EU regulation, they provide some sound level exposure limit, but they do not match. So we have chosen the safer choice, which is the EU version. And EU version is actually one of the newest standards. It's called EN 50332-3, sound system equipment, headphones and earphones associated with personal music players, maximum sound pressure level measurement methodology, part 3, measurement method for sound dose management. And this one hasn't been updated yet, but it specifies sound dose measurement, and it's the first such standard. And it also gives alerts associated with it, and also to reduce the risk of listeners developing hearing impairment when using a personal music player. We didn't limit not just to music player, but we generalized to personal sound player or audio system. And our standard, WHO ITU standard H.870, is based on this principle, and it's dosimetry. But this EN 50332-3 doesn't cover exposure from other sources than PMPs. So that's why we decided to use a different, or in addition to this, we have added some more measurement. Another thing is that this standard doesn't provide enough protection to children. So we defined something more stringent. These EU standards recommend weekly sound dose being limited to the equivalent of 80 dBA for 80 hours per week. And this is what we call sound allowance that Amaryllis was talking about. And it's been shown through the occupational noise exposure that with 80 dBA daily exposure, 8 hours a day, has very small risk of incurring hearing loss following a 40-year working lifetime. But if we need absolutely no risk of hearing loss, then we need to adopt an even lower limit. In other words, 75 dBA for 40 hours, 80 hours a week should be adopted. This applies to more conservative segment of the population, especially for children and also persons with some hearing difficulty. So we adopted these two modes. Mode 1 is standard level for adults. This will apply 1.6 Pascal square hour, which is equivalent to 80 dBA for 40 hours. And this is for general public. But if we need to make it more stringent, then the standard level for sensitive ears, for example, children, will be 0.51 Pascal square hours per 7 days, which is equivalent to 75 dBA for 40 hours. And this is deemed to be suitable for children and other sensitive ear individuals. And I'd like to give you some updates on the second version of H.870. We have just updated H.870 in January 2021, just a few months ago. And this updated H.870 version 2 includes the following features. The first one is dosimeter is mandatory on a safe listening device for mode 1. So any device for safe listening, like Apple's iPads or iPods or iPhones, they should have this kind of dosimeter. And actually, Apple has already implemented the dosimeter according to this standard. And mode 2, which is more stringent, strict recommendation, is not mandatory, it's recommended still. And safe listening device system is recommended to give the user to choose which mode the user wants to follow. So if the user wants to use the mode 2, which is more stringent, then he should be able to choose that mode. And also smart volume control is now a mandatory feature. This function automatically reduces the volume when a certain threshold is reached, but in such a way that the user doesn't notice it. This feature will be very good because the person who exceeds some limit or the sound allowance can still listen to some music, not just like drop a cutoff point, but he can still protect his hearing. And the reference to emerging devices in the market, such as Bluetooth and headsets with storage and other new devices are also mentioned. And also H.870 covers those devices in the scope. And we have several other documents. As I said, there is a gap analysis use cases of safe listening devices, which provides use cases for new devices, such as wireless headsets streaming from smartwatch, or media storage, or PMP sources from Bluetooth. And H.870 WHO ITU standard will be applied to these devices as well. Then we have approved a new technical paper on conformance testing for H.870. This is also a joint work with WHO and ITU, and this defines the implementation requirements to be followed for H.870 compliant device and systems. And so the manufacturers are recommended to read this testing specification before they implement this safe listening device. And we're calling for testing labs globally to be able to test their devices according to this conformance testing specification. And ITU will maintain a database of the experts and testing labs for H.870 and its compliance testing spec. And there are other documents or standards that are related to safe listening. The first one is H.871, which is already approved, is safe listening guidelines for personal sound amplifiers. And this is a guideline for PSAPs and other related devices. And we're working on F.teleaudiology framework of telehealth, e-health, and m-health in audiology. This is a telehealth framework for audiologists, especially during this COVID-19 pandemic, because we cannot have face-to-face consultation. And we're also working on F.MLS app requirements on mobile apps for safe listening venues. This is companion to H.870, and it also defines some kind of a dosimeter-like mechanism for measurement of noise levels in venues. Okay, so that's all for my presentation. Thank you very much for your attention. Thank you.
Thank you very much for that wealth of information. And we're so grateful for all the work you're doing on our behalf, Dr. Kwamori.